Welcome to Cut the Fluff. I'm your host, Dr. Mark Poole. Today I'm very excited to have a special guest, Bruce Woods. Bruce had a career spanning over 40 years as an executive placement specialist, and we've become friends. He's really become something of a mentor to me, and it all started when we met in the hospital because Bruce had to undergo cardiac surgery. And I invited Bruce to come to the podcast to let us in on his experience, how he felt, and what it was like to go through heart surgery. Thank you so much, Bruce, for being here. I really appreciate it. Look forward to discussing this important topic with you today.
Oh, you're welcome, Mark. It's my pleasure, and I look forward to trying to share some things with you and hopefully with other people that will make them both aware of what the process is and as well as some of the speed bumps and more importantly, the good results.
Absolutely. So it's one thing for me to talk to patients about the experience, but I've never had heart surgery myself. So I try not to say too much because I don't actually know how it is, but you do. So I love that. Appreciate you being here. And it's been a while, right? Remind me how long it's been since your surgery.
2012.
2012. Has it really been that long? Wow.
Long. I think it was February 2012.
I tell you what, time flies sometimes. It does not seem like it has been that long. But walk me through that process, though. When you first went to the doctor, your cardiologist, to have your heart checked, what were you experiencing? What was going on at that time?
Well, actually, nothing. I didn't even go to my cardiologist. But I woke up one night about 1 o'clock in the morning, felt strange, got up, walked around, got a glass of water, went back to bed. Everything was fine. Next night, 1 o'clock, same feeling. Got up, took a drink of water, walked around, and nothing changed. So I realized then something's going on. So I woke my wife up and asked her to drive me to the hospital. And I said, I don't know what's going on, but it's not good. We need to check on this, make sure. Walked in the hospital, and they said, can we help you? I said, I may be having a heart attack. And they said, well, come right this way.
Right.
It wasn't their first rodeo.
Yeah, exactly.
So, that's when it started. And then so I was in the hospital one of the emergency rooms for it seemed like an inordinate period of time. They finally got me a private room. And so we moved up there. And then that's when I called the cardiologist and he said, I'll be right over, because he was next door. And he came over, we discussed things. He said, well, obviously I want to run some tests. They did. They were thinking stents possibly. And so by that time, my wife, daughter, and in-laws had arrived at the hospital, and they had been looking up stent surgery. So when the cardiologist came out and told them, they said, "Oh, Dr. So-and-so, we've been looking up stent surgery," and he said he's not going to have stent surgery. He's going to have a quadruple bypass. And there was just this silence in the room. And so we started in on from there. There was another test where they went up to really look at those blocked arteries. And then shortly after that, he told me, he said, I'm going to find a surgeon. And he came back and said, I found this crackerjack surgeon who's this young guy. He's known as the top of the line. And I said, okay. Great, sounds good. And so I'll never forget the first day you walked into the hospital room where I was, because I never left the hospital for, I think it was about 2 days to 3 days before we did the surgery.
Right.
You came walking down the hallway, and here you were. You looked like you were probably in junior high. Because I was expecting some
Nice.
old guy, you know.
Right,
And,
right,
and you're wearing this beautiful blue sport coat with a white shirt and jeans, and I immediately went down to your boots because I'm a boot aficionado. And when you walked
right,
in, you introduced yourself. Then I said, "Are those Lucchese's?" And you said, "Yes." How'd you know that? So
right.
we kind of hit it off right away.
Yeah. No, that's great. I love that. I appreciate that. Tell me how you felt at that time. When you heard that you had to have surgery, was that devastating? Was that not that big of a deal? Was it scary? Just what were you thinking and feeling about the aspect of having to have a surgery?
Well, I never had surgery other than my
Okay.
tonsils out, so
Mm,
I didn't have any good basis for understanding what might be going on. I certainly
sure.
didn't know anything about quadruple bypass surgery. But
Right.
yeah, was I concerned? Yes, certainly I was concerned. Because I thought, well, you hear about people going into surgery and never coming out, and
Sure.
so, or you hear about people that have great results, and so as a believer, I wasn't worried about. I thought, well, if I die, I know where I'm going.
Yeah.
Jesus has already punched my ticket.
Appreciate that.
If I live and survive, what condition am I going to be in? Am I going to still have all my faculties?
Right.
Or is there going to be some hitches? So that was an unknown. And so I didn't spend a whole lot of time thinking about it. I think my family was far more wired up about it than I was. I was just, I
Okay.
just really wanted to get it over with. Let's do
Fair
it.
enough.
Let's do it, get it over with, and get on down the road.
Right.
So that I didn't angst over it a lot. And if I did start feeling that way, I just said, Lord, it's in your hands. So that's
Yeah.
that was calming.
Sure. No, that's great. And I picked that up from a number of patients. I mean, it's all over the map. People feel different things. I mean, nobody feels awesome about it, but some people don't seem to feel too much. Some people are very scared. It's just all over the map. But I do get the sense a lot of people just want to get it over with. They just want to be past that difficulty
Yes.
that they have to go through. What was the response of your family? You mentioned it or alluded to it a little bit in terms of maybe they were a little bit more concerned about things than you were. Did they say anything in particular, or what was that discussion like in terms of thinking about having the surgery with them?
We really didn't talk about it a whole lot.
Okay.
And one of the reasons was that our daughter's father-in-law was a perfusionist, and so
Ah.
he had been in heart surgeries many, 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 many times, as you well
Okay.
know.
Yeah.
And so I think he just kind of gave them the 50,000-foot view without getting into the details. And of
Yeah.
course, as I said previously, I didn't know any of the details or what to expect. Uh,
Sure.
so we didn't really talk a whole lot about it. We did talk about, my wife and I talked about, uh, just briefly, hey, if I don't make it out, you know where everything is. You're covered. We're
Yeah.
good. I'll see you. I'll see you later.
Ah.
And that was about the sum total of it,
Okay.
which I was fine with. I don't think she was quite as fine with it. But so there wasn't a whole lot of discussion, Mark, really.
Fair enough. Now, had you had discussions in the past, just in general, about end of life, having a will, what you would want to have happen if you got in a situation, let's say you were in a coma, quote unquote, and didn't wake up? Are those
Right.
discussions you had had with your wife and family previously? I know a lot of people don't. So,
No, we
just tell
had.
me what your family was like in terms of that.
Yeah, no, we had previously sat down, not too terribly long before, because
Okay.
I started, I didn't have as much energy as I had. Uh, right toward the end of the year, we'd gone to a big Christmas party, and I was just sitting there. I was just kind of tired. Two or three
Hmm.
people walked up to me, ladies that I had worked with, and they said, "Are you okay?" And I said, "Yeah, I'm fine." They said, well, you just don't seem like yourself. And I didn't perceive
Hmm.
that, but they did
Okay.
immediately. So
Interesting.
I was winding. I was getting short of oxygen at that point in time. Didn't even know it. So
Yeah.
prior to that, we had had a discussion. In fact, we had set up a trust,
Hmm.
and did that to make sure that in case something happened to me, everything was covered. It was sheltered. We were good to go. So there wasn't a
Yeah.
whole lot of things to discuss. And having one child, we didn't have a whole lot of beneficiary issues to deal with, but most people do. So I
Yeah.
think it's something that I think people ought to have at least a living will, if not a trust, that covers every aspect of their life when they don't need it, before
Yeah.
they need it.
Right.
I mean, because that's when, if you don't have that and then somebody unfortunately passes, it throws everybody into, turmoil. And
Oh, sure.
it's not necessary.
Well, it adds
So I,
insult to injury. They're dealing with the grief of their loved one having died or being in a dire circumstance, and then they're also having to deal with financial matters, logistics, and all the rest. So I
absolutely.
agree with you. And it's not something that I usually bring up with the patients because I don't like planting seeds of problematic thoughts of hey, you need to fill out your will right before I do your surgery. I mean, it's
Yeah.
not great
That'll
form, I
make
don't
you
think,
feel
for the
good.
surgeon. Right, exactly. But sometimes another team member on our team will do it, maybe a care
Yeah,
coordinator. But it's always best if the family's already discussed it and has the documents in place, and then it's just a continuation of what they had already discussed.
totally
So
agree.
glad that
But
wasn't an issue for you, at least in your particular case.
my cardiologist at the time said uh, he didn't refer to you as a heart surgeon. He referred to you as the best chest cracker in the country. And I thought, that's the first time I'd heard the term chest cracker. And I thought,
Really?
well, I'm sure he's not talking about my chest.
Huh.
Yeah.
Yeah.
And
I mean, I appreciate the compliment, I guess. I mean, but
yeah,
I don't myself ever use the word crack because it just
yeah,
has some aspect to it that seems very violent all of a sudden. So
yeah,
patients
yeah,
sometimes will bring it up. Are you going to crack my chest? Is what they'll ask me. And I usually half jokingly say, no, I'm going to carefully incise it.
yes,
But I
yes.
had not heard that term either. He's the number one chest cracker. That's interesting.
Yeah, and he did say it in a very complimentary way, but I don't think he realized that was probably a quasi medical term that doctors throw around to each other. But you don't say that to
Well,
the
fair
patient.
enough. It
Yeah,
even in my world though, the surgeons and the team, we don't say that. I mean, it's just something that's a little off-putting if you ask me, because it
I
implies
agree.
like breaking of bones and the ribs are breaking. We don't break the bones. We do make a cut through the bone,
Yeah,
usually the sternum. But anyway, interesting. So we set things up, and let's walk through like the night before because I feel like that's kind of a tender time for a lot of patients. They're worried. It's really about to get real.
yeah.
Rubber meets the road kind of thing. It's theoretical up until the night before and the morning of. So, what was that night like for you? Did you sleep like a baby? Did you not sleep at all? Was it tough? I mean, just give me a sense of how that night before your surgery went for you.
Emotionally, I was fine because
Okay.
I was comfortable with the fact that I wasn't in control.
You were
Uh,
at peace with it.
I
Okay,
was at
got it.
peace with it. Yeah,
Yeah.
I knew I needed to have something done.
Yeah.
Um, and so I was at peace with that. I was at peace with whatever the results were going to be,
Okay.
whether I was going home or not. Um, my wife and I just talked a little bit about, um, what a great life we've had. And,
Mm.
but I said, listen, I'm pretty sure I'm coming out of this. I said, I don't have any foreboding sense that this is not going to be good.
Yeah.
And if Dr. Pool's as good as they say he is, we've got as good a chance as anybody to get through this.
Yeah.
And so I was really doing that as much too to encourage her.
Yeah.
But I sleep all night? No, because this male nurse kept coming in trying to take blood, and he was
Yes.
horrible. I asked
Oh,
him one time.
really?
Oh, he's horrible. And
Oh, no.
I said, "Are you on a fishing expedition?" As he trying to calm me down.
Oh,
And he got all flustered. And so I said, why don't you see if you can get somebody else in here? And so
okay.
he brought in this lady nurse, and she was perfect. I mean, she pulled that blood and found that vein, and it was
Nice.
easy. So,
Yeah, yeah,
but
yeah.
no, I wouldn't say I slept a lot that night because interruptions, sounds in the hospital, even though it's kind of quiet. So
Right.
again, going back to our previous conversation, I was ready to get that sucker over with.
Yeah.
Let's get in there, let's get it done, and move on.
Right. Well, it sounds like God blessed you with a peaceful mental, emotional, spiritual state, but you didn't sleep just because of modern day hospital, just the comings and goings, and couldn't get the blood, and that could happen to anybody in a hospital. So it's unfortunate it happened that night, but
Yeah.
at least you weren't burdened by additional angst or tension about it. It
Now,
is very difficult for a number of people. So that's why I would say it was a blessing that you didn't personally feel the weight of that, because a lot of people do. Yeah, what about the morning of? It's pretty early morning. They wheeled you down to pre-op, right? And they're kind of poking and prodding a little bit. Maybe they shaved some hair off. I mean, that's typical for things.
yeah,
What was that whole process like? Was that also emotional for you, or not too bad,
no,
or just
not really. Again, I just already I decided that I'm in God's hands, so whatever's going to happen is going to happen. And,
okay?
and and I'm counting on it to be good. I'm assuming that's His will, but
Yeah,
I'm willing to consider other alternatives, And so I was ready to just kind of get the process over with. Pre-op was not a big deal,
okay,
um, and so what I vividly remember is once they kind of got everything squared away, um, you came over and you said, "How you doing?" I said, "I'm great. Let's get this thing going." And you said, "Yep, we're
right,
going to do that for sure." You said I called in my 18. It was kind of their day off, but I wanted them here, and you said, "So we're going to give you the very best medical outcome that you can possibly get with this surgery."
hmm,
And I thought, well, that's exactly what I wanted to hear. And then you said, I'd like to pray over you before we go in, if that's okay." And I said, "Oh, absolutely." So the
hmm,
crew came over, and we had a prayer, and that was very calming and reassuring. And then it
yeah,
was showtime. So
yeah.
after that, do I remember uh, being awake before the whatever the drug was that hit me? No.
Right.
It was just like, okay, I'm here. I know this is going to go pretty quickly, and that was the last
Right.
thing I remember. You know,
You were out.
I was down.
Good. I like it. No, very nice. No, I appreciate those comments. I'm glad praying together, meant a lot to you. I've prayed with hundreds, if not thousands of patients through the years, and I feel like most people appreciate it. I mean, I ask. I'm not going to force a prayer on
Yeah, of
somebody. I
course.
feel like that's like counterintuitive and weird. I
Well,
usually ask, "Hey, would it be okay if I say a prayer?" Or something like that. And I've had people say no, and I mean, of course it's fine. I
sure.
don't think much about it, other than they decided they prefer not to have a prayer right then. But for those who say yes, I feel like, I mean, it's a legit prayer. I'm appealing to God on behalf of the person and myself and the whole team. And it's also a way to bring comfort and peace to the situation where often people don't enjoy that or haven't yet been blessed that way. So I'm glad that was part of all of it for you.
Well, it was, and I remember too. You specifically asked God to guide your hands, and I thought, wow, that's big.
So your surgery went well. We won't go through technical details, but we got done. We moved you to the ICU. Starting to wake up. Tell me about that.
That wasn't pleasant.
Uh
I'll just tell you right now, that was probably the worst part of it
Yeah.
was waking up and I was intubated, so I had a tube down my throat. I guess that was to help me
Right.
breathe or something.
Sure.
And then,
Well, let me throw in there. So once the anesthesiologist got you to sleep, then they put the tube down. That
okay,
allows the machine to move the air in and out while the whole operation's done. And for a
okay,
lot of surgeries, at the end of the surgery, the anesthesiologist will let the patient wake up and they'll pull the tube out as the person's waking up. So the person or patient never perceived they had a tube. With
right,
heart surgery, because it's such a deep anesthetic, we don't try to do it that way. We just go ahead and put the patient in the ICU because it can take 2 or 3 hours, even 4 hours, for the person to wake up enough to get it out. And we don't just sit them in the OR all of that time.
right,
So it's
sure.
very common to come out of heart surgery with the tube still in and be waking up in the ICU, which is what happened in your case.
Yeah, yeah. So as soon as I woke up, I was very cognizant of the fact that there was this garden hose down my throat. And
Okay, fair enough.
and so I'm trying to move my hands to, I was going to take it out or I was going to get
Yeah,
somebody's attention,
you're going to help
but
them along, sure.
they had my hands tied to the side of the bed. So I wouldn't do that.
Right, exactly.
So I'm like, this is not working out too well.
Yeah.
So my wife was there, bless her heart, she's such a saint. And she said, I could tell you were in so much pain because she said your
Mm,
forehead was just totally wrinkled and you were
okay.
grimacing
Ah,
and trying to point. I'm trying to point, get this thing out of my throat, you know.
right.
And she said that the Holy Spirit just told her, rub his forehead,
Hmm,
massage his forehead. And so as
okay.
soon as she started doing that, she could feel a little tension release in me. And
Great.
then she said she was led to go down and rub my feet. And
Yeah.
that was really that. So, but those two things really calmed me down from being a real unhappy cowboy
Right.
to going, okay, this is, you know, she's here. That's perfect. And but we still need to get this garden hose out of my throat. And so she got a hold of one of the nurses, and they came over and uh, she said, he's in a lot of pain. Can you give him some more painkiller? And they said, no, we can't give him any more right now. We can give him some later. And then she said, well, what about that hose that's in his throat? And they said, well, let us go check with the doctor. So they went and checked with you, I assume, and came back. And so they said, yeah, we can take it out. So when they took it out, boy, that was a major relief. So from there, I don't know how long I was in ICU, but from there, once we got back to the room, um, you know, I felt pretty bad. I was pretty banged up, so to speak. But getting that tube out was wonderful. And so we got in there, and the cardiologist came by at that time, and he brought me a pillow that was the shape of a heart. He said, you're gonna want this." And he said, when you feel like you need to cough or sneeze, you want to get that, you want to have that pillow right there handy and hold that against your chest. And he said, you know, you may say some bad words toward me because you're not going to like it when you cough. And so I thought, okay. So sure enough, you know, there was a point in time where either I needed to sneeze or cough. And once I experienced that pain, which wasn't debilitating, but it was not pleasant, I made sure I didn't have to cough or sneeze much at all. If I felt one coming, Mark, I'm like, oh no, we're not going to do that.
Right, right.
Of
Avoid
course,
coughing.
yeah, you go ahead and do it anyhow. But
Yeah.
that was a little different. And then the next thing I remember was they wanted me up out of bed, and I had tubes in my stomach for drainage, and I had an IV and one of those very fashionable robes that opens in the back.
Of
And they
course.
said, you know, we want you to get up and kind of get moving. And here's this kind of Christmas tree, chrome Christmas tree stand that we're going to hang this bag on. And we want you to see if you can't walk down the hallway. And
Right.
I'm like, walk down the hallway? He said, how about if I just sprint down the hallway? I mean, you're asking a lot. I've just got
Right.
out of heart surgery. And so, but I thought, well, okay, let's see if we can do that. And sure enough, I could.
Yeah.
So I'm going shuffling down the hallway, not walking. I'm shuffling, and my wife said when she saw me, she's like, "Oh my gosh, this is how he's going to be the rest of his life."
Oh no.
Oh no!
Was she joking or
No,
she was
she thought
serious?
this is it. Yeah, because she didn't
Oh
know,
boy.
and I
Yeah.
didn't know either. But anyhow, I made the round down the hallway and back, and got in bed. And they said that's pretty good. And so then the next big highlight was being able to take a shower,
Yeah.
but I had to put on like a vest of some sort to keep the water off the incisions and different things.
This was in the hospital?
Yeah,
Yeah, well, okay, yeah. Sometimes we do, sometimes we don't. It kind of just depends on certain factors. But you were able to take a shower in the hospital. It's great.
yeah, it was probably the third day, day three.
Okay.
So
Yeah, yeah.
surgery day one, recovery day two, then shower day three. And I
Right.
think I was there 5 days. Each day got a little better.
Yeah.
Um, and so when it was time they said, we think you're ready to go home. I'm like, hot dang, let's do that.
Yeah.
So that took place. They wanted me to get a hospital bed and put downstairs because we were in a 3-level house at that time. And I told my wife no. I said
Yeah.
I can make it up those stairs,
Right.
and I did slowly.
That's good. Yeah. Well,
So that was
let me throw in there. I'm glad you made that decision because that input didn't come from me. I don't actually encourage my patients to get a special bed or anything like that because we want the patients to be able to go up and down stairs before they go home. If they can't, then they usually have to go to a rehab facility, and sometimes that's just a few days, and that have to be a long time. But to get enough strength to be able to go home. So
right.
a lot of people on the team. It just takes one to throw that out there. But I did want to clarify. I'm glad you could see that you didn't really need one and you didn't go that route.
I didn't feel like I did. Yeah.
Yeah, it's good. What was that like then at home? I mean, because you couldn't drive, right, for at least a couple of weeks. That's what I usually say.
It's
So I mean,
2 weeks.
was that like a drag or wasn't that bad? I mean, just what were the first couple of weeks at home like?
It wasn't that bad, because you're home, so you've got a comfort factor there. But
It beats the bad sticks for the IV in the middle of the night, right?
beats a fishing expedition in your arm,
Yeah, exactly.
and but I I wore socks, and I remember that I wanted to try and walk as much as I could before I got tired, and then when I got
Okay,
tired, I'd lay down. But
sure.
I was still shuffling. I was still shuffling. In other words, not bad, but I wore the socks so that there wasn't a lot of friction, and so
Hmm.
I'd go up and down or down the second floor and the other end of it and the other end of it. So I was getting I thought a pretty good workout,
Yeah.
just shuffling, walking.
Okay.
And so over a period of about 2, 3, 4 days of that, um, I was getting along pretty good. I was starting to actually pick my feet up and move them, and so I could see the motor skills were starting to return. The feet shuffling were the only motor skills that were affected. I didn't have any motor skills from a digital standpoint, hands, anything above the waist. It was really just my feet.
Okay.
Um, and then the other thing was I lost a lot of weight, which wasn't a bad thing because I didn't have an appetite.
Hmm.
And so I can't remember if I was on any kind of medications or not. That I don't remember that there was a big bunch of bottles of pills laying around. But I thought, I'm feeling pretty good about the fourth day. I might try a martini. Well, I poured a little martini, decided I would try that. And as soon as that vodka hit my taste buds, I I thought that's the worst tasting thing in the world because the
Huh.
drugs that I had had in my system had not been completely gone away,
Okay.
and it changed my taste buds.
Yeah.
And I thought, oh, this is terrible.
Interesting.
I'm not going to be able to have a martini anymore.
Fair
So,
enough.
that went away over a period of time. But
Fair enough. Fair enough.
I did become a real food. I didn't want to eat anything that had any possibility of creating any more trouble for my arteries.
Yeah.
So I
No, that's
was
great.
so that went on for about probably 2 or 3 weeks, and then I
Yeah.
wised up and said, "Hey, this is going to work. I've got to have some comfort food." You
Quality of
know,
life issues here, right?
yeah. Hello.
Yeah.
So and then I kept. I felt good enough that I told the cardiologist. I said, "I want to go to rehab. I want to get going on rehab."
Yeah.
And he said, "Well, you're not. Well, I don't think you're quite ready for that yet." This was probably a week when I'd been home. He
Okay.
said, "You can't drive for another week at least."
Right.
And so I said, "Okay." So about 3 days later, I called him again. I said, "If you don't let me go to rehab, I'm going to take myself to rehab." I said, "Because
Ah.
I'm ready to go."
Yeah.
And he said, "Okay, okay." He said, "Get your wife to drive you over there. I'll make the arrangements." It was the best thing I did, Mark. I would highly recommend that to anybody who had heart surgery,
Okay.
maybe lots of different surgeries, but particularly
Sure.
heart surgery, because the people at the rehab, the nurses, they're so knowledgeable about what's going on for people who just come out of heart surgery and are trying to
Yeah.
recover.
Right.
They take you at your own pace, but
Hmm.
and they take your blood pressure about every 20 minutes, and which is fine.
Sure.
Uh, and, but you walk on the treadmill. You can do a little walking on the elliptical slowly, and then as you feel better, you can increase that. So that's what happened over a period of about 2 weeks to 3 weeks. I think I was there. I think I went back. It was twice a week, maybe three days a week for 2 or 3 weeks. And at the end of that time, so now we're getting close to 2 months from surgery.
Yeah.
I was I was running up
Hmm.
hills where we lived. I mean, I
Really?
was feeling good enough, no pain,
Great.
no no resistance, and so I'm like, I'm gonna walk down the hills and I'm gonna run up the hills, and so I was cranking it, and I thought this is terrific,
Love it.
and so I for the first time I felt really good,
Yeah.
like I used to back when.
Yeah. Yeah. No, that's great. I mean, God blessed you through all of that, each step, obviously. And then I love the proactive nature and how you described it. Basically, you had to sort of halfway force your cardiologist to let you start rehab. It's awesome. That's great. The fact that you were feeling well enough to do that, but also that you're taking the initiative and saying, I got to do more than just be around my house. Like, give me a person that can help me do more. I love it.
Correct.
And I think that's a
That's
big
right.
part of why you did so well is thinking ahead and getting ahead like that. I think it really helped a lot. So that's great.
Well, I think a lot of people are reticent to, suggest to their doctor that, hey, this is what I want to do.
Right.
And when the doctor pushes back, if you feel like you're really in in a position where what you're asking is not unreasonable, then you should do that, because the sooner you get back on your feet and get going and get your body moving, the better everything's going to be.
I love that. And I think exactly the same way. Now, I appreciate how doctors are esteemed and respected, and it's just part of being a physician. But it's odd to me sometimes how far people will take what the doctor says. And it's like, I consider myself a consultant. Like, you can take it or leave it. We're all adults. I mean, I treat adults, I don't treat kids. So, you know what I mean? It's kind of like sometimes people will feel like they're a victim or something, like the doctor's forcing them to do something. I'm like, don't ever think that. you can speak up
Yeah.
and you can decide for yourself. If they say take such and such medicine and you say, I just don't want to, listen to them, hear the rationale for how it will help you. But at the end of the day, if you don't want to take aspirin, don't take it.
Yeah. Or a statin, or whatever
Or
it might
whatever
be.
it is. I mean, I'm just
Yeah.
saying as an example, because the cardiologist put aspirin in the water, virtually. So
Yeah.
I'm not trying to subvert my own specialty or my own
No, no.
occupation. I'm just saying I appreciate it when people think for themselves and take the input of the doctor and say, no, based on how I feel, because you can't know exactly how I feel. Based on how I feel with my body, here's what I'm thinking and here's what I want to do. And I just want people to be able to find a doctor that can work with that, because we are out there. Find a doctor that listens to you and will let you make your choices, and they're just guiding you on this path. Don't you think?
Well, no, totally, totally. But people shouldn't. They should be their own advocate. And as you
Right.
say, so well, I don't want to do that. Tell me why you think I should, and what are the advantages, and then let me make a decision in terms of whether or not
Yes.
I'm in agreement with that, or I'm not. Because at the end of
Right.
the day, it's our body. It's not the doctor's body.
Yes. Right.
Um,
But I feel like
yeah,
as the doctors, we develop these habits where we expect patients to do exactly what we say, and if they don't, then there's something wrong with the patient. And I'm just sitting there going, no, it's not. It's not like that. Like if your lawyer or your accountant suggests something and you disagree, it's that they don't try to force you to do it. I mean, like
yeah,
it's just kind of weird to me, the dynamic sometimes. So my message, all I'm really trying to get at is think for yourself, advocate for yourself. And if you get resistance from your physician, talk through it. But at the end of the day, find a physician who will affirm you and guide you and not try to dictate things that you don't want to have happen. Because I don't feel like that's a great relationship.
no, you're exactly right. I couldn't agree with you more. Couldn't agree with you more.
Well,
I mean,
you've walked us through all that short term. What about long term? Has there been anything? Now you enjoy fishing,
yeah,
right?
I love to fly fish, and
Fly fishing. When was the first time you got back to fly fishing? After the surgery. How long did you wait?
oh, probably less than 2 weeks. I mean,
Two
you know, I,
weeks.
yeah, no, not after
Okay.
the surgery, after rehab.
Oh,
Okay,
okay, okay. Well,
yeah, after,
it is
yeah,
what it is at this point. But
yeah, no,
I just didn't want you to reel in a fish bigger than 10 pounds. That's the limit,
yeah, no kidding. I didn't want to stress myself. No,
Right.
yeah, really about 2 months after the
Okay.
surgery,
Hey,
I
that's
could,
great. That's not too
I,
long.
I'd fish. I'd go. I was schooling some people's horses for them, so I'd saddle up, mount up, and go work with the horses, and
Yeah.
um, take my canoe out. I'd paddle that canoe all around the lake. And that's
Great.
good exercise.
Sure.
And walk our big fat Labrador dog, and that's a big good exercise. So
Yeah.
yeah, everything was back to normal
Mm.
with really 2 months after the surgery, and and
No, that's
and even
great.
before that. But at that point in time, it's like I didn't even have surgery.
Pretty much doing all the things that you wanted to do, and you didn't feel like you were impaired in some way.
Exactly. Yeah,
Yeah.
and
Oh, it's
and
awesome.
felt
Love it.
felt
Thank God
felt a
for
lot.
all of it. Is there anything you wish you could go back and tell yourself, the night before the surgery or something, or to phrase it a different way, maybe something you would tell someone who's facing heart surgery? What's the message you would leave with somebody, if any, based on your experience now having gone through all of
Sure. Well, I think there's two things. One is if you sense that you're having some difficulty and you don't feel like you normally do, I would highly recommend going and getting tested.
it?
Because
Sure.
had I done that before I started having those 2 nights of feeling kind of strange, this would have shown up a lot sooner.
Yeah.
So that was one mistake I made that I would say to people: if you have any question whatsoever, go find out. Okay.
Appreciate that.
Two, I would say when you you determine that you're going to need heart surgery, um, if you have the ability to do some research on some of the surgeons that are available in your area,
Yeah.
because instead of just saying, well, yeah, just whoever. In my case, I got lucky with you. I mean, I hit the jackpot. So, but that's not the case with a lot of other people. So I would say, do your homework on the physician or the surgeon that's going to do the work. Uh, Check some references, um, and make sure that when you meet them, and maybe you go meet them and tell them you want to come by and talk to them for 5 minutes and just see what the body chemistry is like. Because if you don't have good body chemistry, you're not going to feel good about the surgery. Whereas when you and I connected that very first day over the Lucchese boots, and just your your attitude about things and your interest, genuine interest, I thought, this is perfect. This is the guy, because
Well, no, I appreciate it. But how are you supposed to figure out if the surgeon wears cowboy boots or not?
yeah.
No, I'm
Well,
just
you
kidding
can
with you.
ask him.
Well, exactly. No, I
Yeah,
appreciate what you're saying, and honestly, as someone now, I'm in the field, so it's a little bit biased, I suppose, but
sure.
I'm intrigued how many people don't ask for a second opinion. They really don't research their doctors much. I feel like the younger generation now is more because it's this internet based social media world that people are growing up in. There's an expectation you'll check reviews before you go to a restaurant nowadays.
Yeah,
But for some of the older patients, they're just not used to that. They're really not into it all that much. And so they just kind of go where their doctor tells them, like their primary care doctor refers their next doctor, that doctor refers the next doctor, and there's nothing wrong with it necessarily. But the message is that you can shop around a little bit, or maybe to phrase it, you can check and see if there are other physicians that might be able to better take care of you. And then I echo your comments and I appreciate them. Sometimes two great people just don't hit it off, and that's okay.
right,
I
right.
mean, they could have two world leaders of some sort or titans of industry, and they just don't quite hit it off. And there's nothing to say there's anything wrong with either of them. They just didn't hit it off. And so I feel like that's true in the doctor patient relationship. If you meet a doctor and they kind of rub you the wrong way, no harm, no foul. Doesn't mean they're a bad person or anything else, but go and find a second opinion, and you may feel more comfortable with that person. And that positivity when you enter into the operating room matters. I was actually reviewing some studies recently that indicated that how a person perceives they're going to do affects how they're going to do. So if you don't trust
Absolutely.
your surgeon and you're going in wondering, oh, what this guy's going to do, it can affect how you do. So I love the fact you and I hit it off. Thank God it all has worked out. You've been blessed with great surgery, great recovery. 12 years really now since. Love it. And at the same time, I am echoing your message to check out the possibilities of other doctors and surgeons out there. And then that early instinctual response and interaction, go with your gut. If you feel
Yeah,
like, I don't know about this person, get a second opinion. It's perfectly legitimate.
I couldn't agree with you more, because if you get along with that person and you sense that they really have an interest in your well-being versus just, okay, who's the next patient? Yeah, we're going to do your surgery. It's going to be fine. Da, da, da. No, that's not what I want to hear. I want to hear why do you feel like it's going to be fine, and why should I feel like it's going to be fine?
Right.
And not to get into a lot of details, but just as you said earlier, if you just don't have that body chemistry, you need to have that,
Yeah,
especially with something as critical as heart surgery.
I agree.
If you're gonna get a hangnail, well, get it done, okay. But heart surgery, you want to
Right.
make sure you
It
want
pays
to
to be
vet that.
selective. Yeah,
Yeah, you want
exactly.
to vet that pretty well for sure.
Exactly. No, I love it. I appreciate you so much, my friend. Appreciate you coming on. The time we've spent getting to know a little bit more about your experience. I think anyone who hears this or sees this will be encouraged, and that's the point. So
Yeah.
thanks for listening, everybody. Thanks again, Bruce, for being here. And God bless you with a full and healthy life.